Hello everyone, this is NainaMD. Welcome to my show right here in Beverly Hills, Fusion of Science and Beauty. And as you know, my passion is to bring evidence-based anti-aging and regenerative medicine into what is happening now. The cutting-edge technologies are here. There is really a health revolution going on. And today, I've got a fabulous guest. She is or was a physician in China before coming to the U.S., and then she is also an acupuncturist and is a practicing acupuncturist here in the United States. Her name is Meredith Xiangyang, and she is a fabulous, one of the leading Beverly Hills acupuncturists. Welcome to my show.
Thank you for inviting me here.
Well, I wanted to, I think the audience, you're a professor at the Oriental Medicine School or University, right?
Okay.
And there is so much in acupuncture that acupuncture treats. It's like a whole emerging specialty. What I want you to focus on today, and in our discussion, is that we as a Western culture relied on pain medications, and we are in an era now of epidemic era of just prescribing pain pills, right? We prescribe, and we're very quick to prescribe because we don't want our patients to suffer. And having said that, there's so many different kinds of pain. There's pain from joints, there's pains from muscles, there's pains from nerves, there's headaches. And our patients are suffering almost every day with pain. So it is only natural for us to look at alternatives to treating pain. And, instead of just being quick to prescribe pain medications, I really wanted to have the audience get educated on acupuncture. I know they've heard about acupuncture, but to hear it from somebody like you in your perspective, I think is pretty unique. Tell me how you treat pain in terms of acupuncture. What is the basis of that? And also, do you treat different kinds of pain? Like nerve pain is different from joint pain and from muscle pain.
Yes, we treat pain differently, but because we do also has a medical background,
yes.
So we need to diagnose this patient. So when the patient come, we need to ask what kind of pain they have. So then we need to focus that aspect. Like you said, we have a different kind of pain. Can be headache, can be joint pain, can be muscle pain, can be nerve pain. So we need to ask a patient what's the chief complaint for that pain.
Yes.
So, for example, if it's a joint pain, so we need to ask what kind of joint pain. So, because we train students here also integrate medicine, so we can see it is the rheumatoid arthritis, that will be autoimmune, and also can be the osteoarthritis, will be degenerative disorder, and also can be the gout. So, different joint pain we treat differently. So, for example, if the rheumatoid arthritis is autoimmune, so we need to see which stage they are. So if it is like a flare-up, so that will be for the Chinese medicine will treat them as because they have too much antibody at that moment, so we need to clear heat toxin.
I see. You need
to clear the heat toxin in
yes.
the way it's like suppress the antibody. So that clear heat toxin is kind of similar function as the steroid.
Okay.
So, but we use different means. We use the herbs and the acupuncture. So, herbs and acupuncture do not have side effects of the steroid.
Got it.
So, at that stage, we just suppress them. So, after that, the acute stage over, if it's rheumatoid arthritis, the patient still have pain. So, we make tonify. So build up the strength and the immune system to balance, so to stay off the pain.
So first acutely get rid of the toxin,
yeah.
Then you tonify to build up the immune system.
Yes.
And autoimmune. I mean, it makes so much sense because you're treating the root cause, right?
Yeah.
What about nerve pain?
So nerve pain also has many kind of,
yes.
Can be, injury. So
yes.
if it's a spinal cord injury, so then we said at that moment the patient also we use herbs to move qi and blood to release that hematoma or tissue damage, and also after that remove the change blood, then we will use certain herbs,
Right.
then to regenerating tissues. So
Right.
we do have the herbs also. So that will be acute nerve damage, and also could be chronic. Like some patient has the peripheral neuropathy,
Yes.
so could be associated with the diabetes. So then for that it will be chronic. So we will usually use different way to treat. So we will tonify change blood.
I see.
So different way, we need to know what kind of pain and what kind of damage to the nerve, then we treat it accordingly.
Yes. And acupuncture, is it by the placement of the needles? So let me ask you this, because when I look at acupuncture, I see placement of needles, right?
Yeah.
But are there certain needles placed in certain areas which help eliminate the heat, the heat toxins?
Yes.
And when you tonify to build up, are the needles placed in certain areas? Is that how it
Yes,
is?
yes.
It's where the placement of the needles is, right?
Yes.
That differs in the treatment?
So acupuncture is that we use needle to put in certain points. So these certain points is located at different meridians, and the different meridian connect with internal organs. So then when we see the patient, we diagnose this patient to see which organ has a problem and which meridian has a problem. Then we select a point according to patient's condition. So for example, we said when the patient has a rheumatoid arthritis had the flare up, so we need to clear heat toxin. So then we need to select the points which can eliminate the heat toxin. For example, we use points like Li4, Li11 to 14, and spleen 10. So this kind of points to eliminate the heat toxin. So we also, when we say is a recovery stage or the patient's kind of, we try to rebuild up the strengths. So we use different points like the stomach 6 and spleen 6 and the kidney 3. So these points is tonify energy, so tonify strengths to balance the immune system.
I see.
Yeah.
And what about people who have have in their head, like they're very low tolerance, like fibromyalgia, and because we're seeing a lot, usually in conventional medicine, fibromyalgia was like a garbage bag term. Now there are clinics in fibromyalgia. This is for people like me, I say it's mitochondrial dysfunction, right? How do you treat something like fibromyalgia, where the muscles are so sore?
Yeah, for the fibromyalgia, because for the Chinese medicine, as long as the patient has a pain, so we say that they have certain kind of blockage.
I see.
So when the patient comes, we need to see where they have most pain. So we try to move energy in that area. So in this way, it's unblock the blockage. So we say the move change blood to reduce pain. But sometimes the fibromyalgia also, certain patient has the emotional components. So when we treat the fibromyalgia, also to balance the emotion. So Chinese medicine, we treat the pain, we also try to balance mind and the body. And actually, when we insert the needle to the body, so we also change the endorphin in the brain. So we change the endorphin in the brain. That also can help the pain conditions. Yes.
How many of all your practice, and you see so many people, which kind of pain do you see the most?
Almost every kind of pain, because I practice China, Israel, here, and Europe.
What are your patients? What kind of pain do they present with?
Any kind of pain.
Any kind.
Headache, and also, we said, arthritis, and also some patients come from for the irritable bowel syndrome, abdominal pain.
Irritable bowel is supposed to be very good,
also the patient has Crohn's diseases. The patient has ulcerative colitis. So because I have a lot of patients come cedar, so that's for abdominal pain associated with the intestine disorder.
Give us your biggest. Do you recall one patient that is like just amazing? I know all of your patients are success stories, but can you tell the audience maybe of one patient where you did a series of acupuncture treatments that just everything resolved? Something that you remember just offhand that was a very successful treatment?
So I have done a lot of pain also in Israel. I work in the Shiva Medical Center because Israel is a lot of wounded soldier. So they have phantom pain. So phantom pain, that's acupuncture has better result than even the drugs. So because in there I treat a lot of soldiers in the Telashama hospital. So that's also can be very good example for acupuncture pain control.
Pain control.
Yeah.
Wow, that's really, really fabulous.
Yeah.
What about headaches?
Headaches.
Everyone has headaches.
I think that is a headache, because headache is also is headache for doctors also, because it's our stress out, our life. So
It's so
especially
stressful.
living in California, of course we're enjoying the weather, but also stress.
Yes.
So stress can create a headache, but when we diagnose this patient, also headache to make sure the patient doesn't have a really mechanical problem. So for example, the headache, if it's a primary headache, then like a migraine headache, tension headache, a cluster headache. So for this kind of primary headache, so acupuncture do have a good result because we de-stress the patient. And they can help. And also, if for secondary headache, so we need to rule out the patient has a problem. Sometimes the patient headache is due to toothache or some kind of infection in the teeth. We will send the patient to the dentist to correct
But
the
I've
teeth.
seen, the thing I want to focus on that I've seen, and I've worked with clients, cluster headaches are the worst. I've seen patients, their lives, they cannot work.
Yeah.
Their whole lives have changed.
Yeah.
And sometimes the cluster headaches sometimes have an interplay with, with just the hormones.
Yes.
So, have you had success with cluster headache patients?
Cluster headache, most of the time for my experience, mostly cluster headache is male patient for me. So male patients, so usually I do to balance them, because male patient maybe consider related to testosterone. So for the testosterone, so for this patient we needed to also kind of cooling the patient. So when the cooling patient is maybe balance the hormones, but most of the time this also could be related to vessels. So we do help the patient.
Yes. And what in terms of the pain, have you even seen patients being more calm right after? Like, have you ever worked with patients that have come out of surgery? Like,
Yeah, I do. Yeah. Because I used to work in the hospital in China, in the Israel for many years. So we do after post-operation treatment. So that's also after operation. So we go in, because in China the acupuncture is in the hospital. So we do also in the hospital after operation. We can treat the patient in the hospital department, even in the waiting room, not waiting room, in the after surgery, post-surgery room. So we can treat the patient to release the patient tension and also to rebalance the system.
Very
so
good.
Yeah.
How do people look you up?
I think most of, because I'm here many years.
Yes.
Here in
Do you have a website?
I have a website.
What is the website?
Website is Beverly Hills acupunctureherbs.com.
Beverly Hills acupunctureherbs.com.
Yeah.
Okay. And I think this is going to lead us to one of the next topic, and that is which I do a lot of, and I see so many women and men with hormonal imbalances. Okay, and hormonal imbalances are great. Yes, we need to use hormones, but my whole philosophy has been, let's try to minimize. We use what we call low dose physiological replacement therapy, but we combine it with either herbs or nutrigenomics or acupuncture.
Yes.
So I think that leads us into the next topic, and I know we're going to start that right after this break. And also we want to know what you do to take care of yourself.
Thank you.
Because you've worked for 33 years, you look amazingly rejuvenated. So you got to share those secrets with us.
I will try if I can.
All right,
Thank you.
We're going to be right back. This is Dr. NainaMD, Beverly Hills, Fusion of Science and Beauty. Hello everyone, welcome back to the show. This is Dr. NainaMD, Beverly Hills, Fusion of Science and Beauty, bringing you the best of anti-aging and regenerative medicine, all evidence-based. And we're discussing acupuncture and how it can alleviate pain. And continuing back is we're going to discuss how acupuncture can actually help with hormonal imbalances. And I have a fabulous, fabulous guest. She's one of the leading acupuncturists in Beverly Hills, has been an acupuncturist for over 33 years. Tremendous, tremendous experience. And she also is a professor at the Oriental Acupuncture Institute, and she also is just an amazing wealth of information, amazing person. So Meredith, welcome back. So you were talking about that, acupuncture and helping with pain. What about the hormonal imbalances? And I especially want to know your perspective because you were also a doctor in China, and then before going into acupuncture, tell me about how you handle something like this in terms of with acupuncture.
Okay, thank you for inviting me again. So now, in China and also here, I look the hormone imbalance as for the Chinese medicine, we consider this patient has a yin-yang imbalance. Okay, so if it's a female patient comes, so especially when the female complain about less estrogen, so especially around the menopause or perimenopause, so for that we say there is an insufficiency. So this insufficiency translates to Western medicine, it is estrogen deficiency.
Okay. What do you see? What do these women complain to you of?
So if it's insufficiency, like the patient complain, it's like estrogen deficiency, like cannot sleep well, and the mood swing, and the night sweats, and the flash, hot flash. So this we can consider as perimenopause or menopause. Of course, if it's perimenopause, menstruation starts shifting. So for this, we will balance the tonify yin. So this tonify yin also linked to the organ. For the Chinese, organs will be kidney essence deficiency or liver blood deficiency, and with kind of empty heat, like hot flash. So we use herbs, acupuncture points to balance the kidney, balance liver. So in this way, the essence blood will be nourished. So in this way, can build up the yin. When they build up the yin, so in the way that the patient feel less that withdrawal of the estrogen from the ovary. So in this way, had patient to overcome the estrogen decline associated with ovary failure. So in this way, we balance the hormones. So after that, we also tonify patients so that the patient feels more more rejuvenate. It's like you do the beauty in a way when your patient more balanced, so they look prettier.
Yes.
So that's also with Chinese treatment is more in and out. Yes. So that when the inside are balanced, so then they also looks prettier. Yes. So that's use herbs and acupuncture.
Now, what about when you see women with progesterone, if they're progesterone deficiency? What happens there?
Okay, so usually,
or what kind of symptoms do they come with you with progesterone deficiency?
That's say with different age. So if it's at a reproductive age, so if it's a progesterone deficiency, usually they have the menstruation abnormal and sometimes associated with difficult to get pregnant. So for that estrogen decline, so the patient feels like could associate with fatigue. And also menstruation irregular
or heavy cramping. What about like painful menstrual cramping?
For the Chinese medicine, we will. For the progesterone, we consider is a thermogenetic. So for this patient, in a certain aspect, we need to tonify yang. When the tonify yang, so progesterone thermogenetic function will enhance. So this patient will feel more energetic.
Got it.
So then, in a way, also can balance the patient fertility. So they can also outcoming could be also bring the kids to the family. So that's we need a tonify yang. So this tonify yang can tonify kidney also.
Got it. Got it. And what about women, as we know, would they need testosterone, right? They produce it. So, and the levels we know now are starting to decline as early in their early 20s even. So what symptoms do women present with testosterone deficiency?
So if it's testosterone deficiency, some of them could be fatigue, physically, mentally, and also no sexual drive. That's also part of it. So for the Chinese, we will tonify kidney essence. Testosterone is young, so maybe kidney yang is weak. So we tonify kidney, can build up testosterone. So patient feels strong, more, and also more energetic, and also sexual drive can enhance.
I see. And in males, same thing. When they come with they're losing their testosterone, we have something in male andropause. Do you treat
We
males?
do, you do,
Very
yeah.
good.
Because the male, since they, I think also from 30s, the testosterone decline.
Yes, but we're seeing more and more men
I know.
earlier on
Yes,
declining.
since the 30s, the decline. Of
Why
course,
do you
on
think
the
that
rich,
is? Why do you think that is?
sometimes it's life, stress, and also nutrition, lifestyle, not properly. So then they also main testosterone decline. When they reach 50, it's we said sometimes the patient also we talk to the man, you have the andropause.
Yes.
Woman is menopause, man is andropause. So
Yes.
they also has the erectile dysfunction.
Yes.
Okay, so impotence. So that also happened to the men. So we do also same, use herbs, use acupuncture, use tonified kidney, can improve the level of the testosterone.
Very, very interesting. And what if you had in all of your treatments, especially in this these menopause women, have you found any one treatment that is just that overall benefits these women? Meaning, what I'm trying to say is that do you use different acupuncture techniques to treat each of those hormone imbalances, or can you use maybe just a few techniques to help balance all the hormones?
Usually,
acupunctures?
Chinese medicine is different from Western medicine.
Yes, that's
so
the
we
point.
are more individualized. So same terminology, estrogen decline, testosterone decline, and also the progesterone decline. Everyone present a different presentation. So
see.
in this way, we treat each individual
It's based on the
patient,
symptoms.
same person.
Yes.
Yeah, same. This patient has different symptoms. We treat different.
Got it.
With the
That's
different
what I wanna
points.
know. Yes.
So not like Western medicine, everyone same. Just
we're
the
just
hormone
declining.
replacement.
Yeah, exactly.
Hormone replacement. So
Yeah.
that's why it's Chinese medicine. I think in the way has better result because we respect the patient and also individualize. So has a better result.
I see.
Yeah.
And tell me, how do you keep so young?
Oh.
What do you, when you get up, do you exercise first of all?
I'm not keen to the exercise. I do not do exercise.
But are you very active?
Very active. So for me, I believe it's movement. So movement for me is walking because most of the time I walk from my home to the clinic.
Very
Because I
nice.
live locally, 15
Very
minutes,
nice.
I walk. So
Very
then they eat properly.
Yes. What do you eat? Like in the morning, what do you eat?
In the morning, fruits,
Yes.
egg,
Yes.
and the milk.
Okay.
Yeah.
And then what do you have for lunch?
Lunch, so supposedly, sometimes if I'm not busy, so I can go home to eat. So usually Chinese food, we have some vegetable and the protein. I like eat the protein.
Okay.
So mostly it's a protein like the
What
fish.
kind of protein? Fish? Okay.
Fish and also beef, chicken
Beef, okay.
with vegetables.
Okay. And what about dinner?
Dinner, same. So dinner is the same kind of like
Okay.
lunch.
Do you have a sugar craving ever?
Oh,
or no?
I have sweet tooth. I like sweet.
I see.
So any sweet I like, I
Yes.
eat a lot.
I
So
see.
then, yeah, sleep.
Sleep, okay. And just, you get a good night's sleep.
Good night's
is good.
sleep, and during the day. So if patient cancel it or between the lecture in the university, I sleep.
Very nice.
Yeah, so it's like a recharge.
Yes,
Yeah.
because we know about the benefits of
Yeah.
it. I think so many people are sleep deprived, which I guess we can, we'll do this for another show, but anxiety and depression are, and insomnia are so
Yeah, it's a
many
problem.
serious. It's a problem, isn't it?
Yes.
It's such a problem. Do you teach? You teach right at
I
the
teach
students?
3 university. I teach the master, doctor degrees, both.
Wow.
For the acupuncture here. Yes.
It's a pleasure, to have had you on their show again. Which is the website?
It's Beverly Hills acupunctureherbs.com.
Beverly Hills acupunctureherbs.com. And what generally, if patients came to see you, how many treatments? Just generally, I know not everything is the same; it's personalized. But in general, how many sessions of acupuncture? Let's say for pain is I know you should keep coming, but let's say for them to start seeing a result, how many treatments would you say?
So
you generally do?
usually when the patient first
And how
come-
frequent?
Yeah, first time the patient come, so I have a treatment plan for the patient. So most of the time, I explain to the patient is 10 times treatment as one course.
Oh, I see. 10 treatments.
Yeah, acupuncture is also the result is cumulative. So
is it 2 times a week or once a week?
Usually at the first 3 weeks, I ask the patient come twice a week. Then after that, once a week. But it depends if the patient has acute pain, like sciatic pain, they will come first 2 weeks, 3 times a week. So it depends the patients, but the minimum is 10 sessions. So after
10 sessions.
After feel better, then we tap down. Could be once a week, once every other week.
I see.
So
So once a week, once every other week, or once every 2 weeks. Well,
Yes.
however, I mean, once every. Do you have it just once a month? People come.
Yeah, some people once a month. They come just
For maintenance, right?
Yes. Yeah.
But to get through the session, about 10 sessions, everyone. So kind of plan on that.
Yes.
If you're looking to acupuncture, I don't think you can make those generalizations that, oh, I tried acupuncture, it didn't work. The expert is telling us that you need to have at least 10 sessions in order to really start seeing results. And I think that's very important because so many of my clients will say, yeah, I went to acupuncture, but they don't go twice a week.
Yeah.
Nobody told them, or they don't go, they go one acupuncture, then 3 months later they go to another one, and then they say, oh, it didn't work. Well, you didn't give it a try.
Thanks.
So I think that's very, very important. Your use of Chinese herbs, again, we're becoming a very self-regulated industry. You always use like the herbs which are unadulterated, right? We make sure the companies are, and I think we just want to reassure the audience that everybody just thinks Chinese herbs are like bad or they're adulterated. So can you just give us I know we're very little time left, but just a brief thing on Chinese herbs, you know.
So Chinese herb is plants. So usually.
But how do you ensure quality?
Because
we want to reassure the audience
you
about,
need to select a good company. Usually
What are some of the good companies?
So qualified, so quality. So usually I use different companies like UPC, this kind of Chinese herb, or in the China, Montreal Park, they have also Dechenghan, all kind of. I usually import the herbs from the good company. So usually,
I see.
Yeah.
Do you make the concoctions do you get the herbs and make the concoctions, or do you already get from like UPC there's already made?
Yeah, we usually have a different formulation. We have raw herb, so the patient need to cook. So then we have the powder. So it's a quality herb, so the patient makes at home to make tea to drink, or patent pills. I think Americans like to have patent pills.
I see.
Yeah, for special patient, I will make the capsule for them.
Yes.
Yeah.
Okay. All right.
Yeah.
That's fabulous. And then, so I think we just want to reassure the audience that really we've got quality. There are herbs that you can actually get. The Chinese herbs. Don't be afraid of Chinese herbs. When they're in a controlled environment, when you've got a very specialized acupuncturist who is looking at the companies that make and ensure quality, they do third-party certification.
Yes.
They are self-transparent and they regulate. You know, the supplement industry is a regulated, as the herbal industry, it is a regulated industry, despite what media says. You know, and I think that's just very important to know. Listen, thank you so much for being on the show. You've given such an insight. You guys, take-home message is 10 sessions, okay? You don't just do 1 or 2 sessions and tell me it didn't work. You got to do 10 sessions. So please look her up. Again, the website is
Beverly Hills AcupunctureHerbs.com.
Beverly Hills AcupunctureHerbs.com. Thank you again, Meredith.
Thank you for having me.
And you're an amazing doctor and an acupuncturist. So this is NainaMD, Beverly Hills, Fusion of Science and Beauty. We'll be back next week with another great show.